Pacemakers and heart failure, an overview of optimal management, patient safety, and future innovations. For individuals living with congestive heart failure, CHF, and relying on a pacemaker, navigating the path to better health involves a delicate and intricate balance. Beyond simply regulating heart rhythm, modern pacemakers offer sophisticated support, but their effectiveness is profoundly influenced by everything from medications like metoprolol and exercise routines to potential malfunctions and patient involvement. This overview delves into understanding pacemaker functions, how triggering events are managed, crucial safety considerations, and the vital role patients play in their own care, all while looking ahead to the future of these life-changing devices. Pacemakers, more than just a steady beat. Modern pacemakers are sophisticated devices that continuously monitor and regulate the heart's electrical activity. They record a wealth of data, including the number of triggering events, instances where the pacemaker delivers an electrical impulse to stimulate a heartbeat. This information is vital for doctors to assess the device's function and optimize its settings during regular checkups. While patients don't typically see a live counter of these events, the data is a key indicator of how often the pacemaker is stepping in to support the heart's rhythm. Remote monitoring systems and direct communication with the healthcare team can provide patients with some insights into their device's activity. Understanding different pacemaker types in CHF. The type of pacemaker implanted is crucial and specifically chosen to address the individual's heart condition and needs, especially in heart failure. Single-chamber pacemakers. These devices have one lead, typically placed in the right ventricle or right atrium. While they can provide basic rate support, they are less common for CHF patients who benefit from more coordinated heartbeats. Dual-chamber pacemakers. These have two leads, one in the right atrium and one in the right ventricle. They are designed to maintain the natural synchrony between the atria and ventricles, AV synchrony, which is often beneficial for optimizing cardiac output. Cardiac resynchronization therapy, CRT, devices, biventricular pacemakers. These are particularly vital for many CHF patients, especially those with impaired pumping function and electrical conduction delays. CRT devices have three leads, one in the right atrium, one in the right ventricle, and a third lead that paces the left ventricle. By pacing both ventricles simultaneously or with precise timing, CRT helps to resynchronize their contractions, improving the heart's pumping efficiency and alleviating CHF symptoms. Implantable cardioverter defibrillators, ICDs, with pacing capabilities. Many CHF patients are at risk of dangerous, life-threatening arrhythmias, abnormal heart rhythms. While the primary function of an ICD is to deliver an electrical shock to reset such rhythms, most ICDs also include full pacing capabilities, often acting as a dual-chamber or even a CRT pacemaker, known as a CRTD. The question of normal triggering and its impact. It's important to understand that there isn't a single, normal range for triggering events in CHF patients. The ideal number varies greatly depending on the individual's underlying heart rhythm, pacemaker programming, intrinsic heart function, and clinical goals. Doctors focus on ensuring an adequate heart rate, optimizing the coordination between the heart's chambers, and achieving synchronized contractions when necessary. However, as many patients astutely recognize, frequent and unnecessary pacemaker triggers can lead to unwanted side effects such as fatigue and disrupted sleep, potentially worsening the heart failure condition. This underscores the critical need for careful optimization of pacemaker settings by a cardiologist. Key pacemaker programming parameters. Beyond the basic rate, cardiologists carefully program several parameters to optimize pacemaker function. Base rate, lower rate limit. This is the minimum heart rate the pacemaker will allow. If the intrinsic heart rate drops below this setting, the pacemaker will deliver impulses to maintain it. Upper rate limit, URL. This is the maximum rate the pacemaker will deliver, especially during physical activity. It prevents the pacemaker from pacing the heart too fast, which could increase cardiac workload unnecessarily. AV delay optimization. For dual-chamber and CRT devices, this is the precisely programmed time interval between atrial and ventricular pacing. Optimizing this delay is crucial for maximizing ventricular filling and improving the heart's pumping efficiency in CHF. Rate response algorithms. Modern pacemakers are rate responsive, meaning they can adjust the pacing rate in response to physical activity. These algorithms use internal sensors, e.g., accelerometers detecting body movement, or minute ventilation sensors detecting breathing rate, to mimic the heart's natural response to exercise. These algorithms are finely tuned to individual activity levels. Sensitivity settings. These determine how well the pacemaker sees or senses the heart's own electrical activity. Correct sensitivity is vital to prevent the pacemaker from triggering when it's not needed, oversensing, or failing to trigger when it is needed, undersensing. The role of medication, metoprolol and pacemaker function. Medications like metoprolol, a commonly prescribed beta blocker for CHF, can further complicate this balance. While effective at slowing heart rate and improving cardiac function, it may cause side effects such as fatigue and, in some cases, insomnia. Therefore, physicians must consider how frequently the pacemaker is triggered when determining the appropriate metoprolol dosage. Excessive pacemaker activity, combined with these side effects, can significantly affect a patient's quality of life and potentially their long-term outcomes. Defining excessive triggering, a holistic approach. Determining what constitutes excessive triggering isn't based on a simple number. Instead, doctors utilize a comprehensive approach, considering patient symptoms, reports of new or worsening fatigue, sleep disturbances, palpitations, or reduced exercise tolerance are crucial indicators. Pacemaker diagnostic data, the percentage of pacing, how often the pacemaker is active, the frequency and patterns of triggered events, and any signs of sensing issues are carefully analyzed. Comparison to programmed settings. Doctors ensure the pacemaker is functioning within the intended parameters, such as the base rate, upper rate limit, and sensitivity settings. Clinical context. The patient's underlying heart condition, other medical issues, and medication effects are all taken into account. Common pacemaker-related considerations and complications. While highly beneficial, pacemakers can sometimes lead to issues that affect CHF patients. Pacemaker syndrome. This can occur when the heart's natural atrial and ventricular contractions become unsynchronized, often due to pacing only the ventricle. Symptoms can include fatigue, dizziness, shortness of breath, and neck pulsations, mimicking or worsening heart failure symptoms. Dual chamber or CRT pacing often mitigates this. Lead-related issues. Pacemaker leads, wires, connecting the device to the heart can sometimes dislodge from their position, break, or cause issues with the tricuspid valve, leading to tricuspid regurgitation, if placed in the right ventricle. Infection. As with any implanted device, there is a small risk of infection at the implant site. Device malfunction. Less severe although rare, electronic components within the pacemaker could have minor malfunctions, e.g., occasional undersensing, that may not immediately cause severe symptoms but require attention. Pacing-induced cardiomyopathy. In some cases, long-term, high-percentage pacing of the right ventricle, especially with traditional pacemakers, less so with CRT or newer pacing modalities, can paradoxically lead to a weakening of the heart muscle. Pacemaker malfunction, a potential emergency. While routine monitoring and checkups are designed to detect issues before they become critical, it is crucial for patients and their caregivers to be aware that a pacemaker stopping or severely malfunctioning can create a life-threatening emergency, particularly for individuals who are pacemaker dependent, meaning their natural heart rhythm is too slow or absent to sustain life without the device. Why it's an emergency: if a pacemaker stops working, the heart rate can drop dangerously low or cease entirely, leading to an immediate and severe lack of blood flow to the brain and other vital organs. Symptoms of a pacemaker emergency. These symptoms often appear suddenly and are related to insufficient blood flow. If you experience any of these, seek immediate medical attention. Call 911 or your local emergency number. Sudden or severe dizziness, lightheadedness, or feeling faint. Fainting, syncope. Extreme shortness of breath or difficulty breathing. Severe chest pain or discomfort. Sudden, overwhelming fatigue or profound weakness. Confusion or disorientation. Prolonged or severe palpitations, feeling your heart race or skip beats irregularly. Potential causes of emergency malfunction. Lead fracture or dislodgement. The wires connecting the pacemaker to the heart can break or move out of their intended position, preventing proper electrical impulse delivery. Battery depletion, rapid/unexpected. Although devices typically provide ample warning, rare and sudden battery failures can occur. Device circuitry failure, extremely rare, but internal electronic components within the pacemaker itself could fail. Severe infection, a significant infection around the device or leads could interfere with its function. External electromagnetic interference. While modern pacemakers are well shielded, extremely strong electromagnetic fields, e.g., from certain industrial equipment or unapproved medical procedures like an MRI, could rarely cause temporary or permanent malfunction. Patient's role in preventing emergencies. While your healthcare team diligently monitors your pacemaker, there are vital steps you, as a patient, can take to minimize the risk of malfunction and ensure your device works effectively. Attend all scheduled follow-up appointments. Regular device checks. These appointments, often every 6 to 12 months, or more frequently if needed, are critical. During these visits, your cardiologist or pacemaker technician will interrogate the device using special equipment. They check battery status, lead integrity, how often the pacemaker is pacing, and adjust settings as needed. Early detection. Many issues, like a weakening battery or subtle lead problems, can be detected and addressed proactively during these checks, long before they become an emergency. Utilize remote monitoring systems. If you have a remote monitoring system, ensure it is properly set up and functioning. These systems transmit data from your pacemaker to your clinic, often daily or weekly, allowing for continuous oversight and early detection of potential problems without an in-person visit. Report any issues with the remote monitoring system to your clinic immediately. Carry your pacemaker ID card and/or wear medical alert jewelry. Always keep your pacemaker ID card, provided by the manufacturer or clinic, with you. This card contains vital information about your device type, model, leads, and implant date, which is crucial for emergency responders or new healthcare providers. Consider wearing a medical alert bracelet or necklace that states you have a pacemaker. In an emergency, this can quickly inform first responders. Be mindful of electromagnetic interference, EMI. Most common household electronics are safe, but devices with strong magnetic fields or electrical currents can potentially interfere with your pacemaker. Cell phones. Keep cell phones and other wireless devices, like tablets or smartwatches, at least 6 inches, 15 centimeters, away from your pacemaker. Use the ear opposite to the side of your pacemaker, and avoid carrying the phone in a chest pocket directly over the device. Magnets. Avoid placing strong magnets, e.g., from certain headphones, magnetic therapy products, or industrial equipment, directly over your pacemaker. Power tools/industrial equipment. Use caution with or avoid strong power tools, like drills or welders, and large industrial machinery that generate powerful electromagnetic fields. Maintain a safe distance as advised by your doctor. Security systems. Walk quickly through airport security scanners and store anti-theft systems. Avoid lingering near them. Inform security personnel that you have a pacemaker. You may request a pat-down instead of a handheld wand, or ask that the wand not be held directly over your device for prolonged periods. Induction cooktops. Maintain at least a 12-inch, 30 centimeters, distance from induction cooktops while operating them. Always tell all healthcare providers, doctors, dentists, technicians, that you have a pacemaker before any medical procedure or test. This includes MRIs, unless your device is specifically MRI compatible, diathermy, or procedures involving electrocautery, as these can interfere with pacemaker function and require special precautions or temporary reprogramming. Protect the implant site. During the initial healing period, typically 4 to 6 weeks after implantation, follow your doctor's specific instructions regarding arm movement and lifting restrictions to prevent lead dislodgement. Avoid direct trauma or strong blows to the chest area where the pacemaker is implanted. If you play contact sports, discuss protective padding with your doctor. Recognize and report symptoms promptly. Be vigilant for any new or returning symptoms that you had before the pacemaker, or any of the emergency symptoms listed in the pacemaker malfunction, a potential emergency section: dizziness, fainting, severe shortness of breath, chest pain, extreme fatigue. Also, watch for signs of infection around the implant site: redness, swelling, warmth, discharge, fever, chills. Do not delay reporting these symptoms to your cardiologist or seeking emergency medical attention if symptoms are severe. Adhere to medication regimen and lifestyle recommendations. Take all prescribed medications, including those for heart failure, exactly as directed. These medications work in conjunction with your pacemaker to manage your overall heart health. Follow guidelines for a heart-healthy diet and appropriate exercise. By taking these proactive steps, patients can play a crucial role in safeguarding their pacemaker's function and significantly reducing the likelihood of device-related emergencies. Exercise, a double-edged sword. Encouraging appropriate exercise is vital for CHF patients with pacemakers, improving functional capacity and overall well-being. Rate-responsive pacemakers are even designed to increase the pacing rate in response to physical activity for those whose natural heart rate doesn't rise adequately, chronotropic incompetence. However, the question of excessive exercise arises. While the goal is to mimic a natural physiological response, pushing the body too hard could lead to prolonged periods of high-rate pacing, potentially increasing the workload on the heart. It could also lead to exceeding the pacemaker's programmed upper rate limits or, in rare cases, increasing the risk of arrhythmias. Navigating exercise safely and effectively. Determining appropriate exercise levels is a collaborative effort. Doctors consider individual patient condition, pacemaker function and settings, patient symptoms during activity, exercise stress test results. These tests are crucial for determining safe and effective target heart rate zones and assessing how the pacemaker responds to physical exertion. Adherence to established guidelines. Key principles for exercise include starting slowly, listening to the body, working within recommended heart rate zones, focusing on moderate intensity activities, and maintaining open communication with the doctor. The crucial role of cardiac rehabilitation. For CHF patients with pacemakers, cardiac rehabilitation, CR, programs are highly recommended and can be transformative. CR provides a structured and supervised environment where exercise physiologists, nurses, and other healthcare professionals guide patients through safe and effective exercise regimens tailored to their specific condition and pacemaker settings. CR offers numerous benefits. Supervised exercise reduces anxiety about exercising safely. Individualized plans ensures exercise intensity and duration are appropriate. Education teaches patients about their heart condition, pacemaker, medications, diet, and lifestyle modifications. Symptom management helps patients recognize and manage their symptoms effectively. Improved confidence and quality of life empowers patients to take an active role in their health. Psychological support addresses the emotional challenges often associated with CHF and chronic illness. Emerging technologies and future directions. The field of cardiac pacing is continuously evolving, with exciting advancements focused on improving outcomes for CHF patients. Newer technologies are aimed at mimicking the heart's natural electrical system even more precisely and enhancing device capabilities. Conduction system pacing, e.g., is bundle pacing, left bundle branch area pacing. These advanced techniques are gaining prominence. They aim to pace the heart's natural conduction pathways, like the his bundle or left bundle branch area, rather than just the right ventricular muscle. This approach more closely mimics the heart's physiological electrical activation, potentially reducing the risk of pacing-induced cardiomyopathy sometimes seen with traditional right ventricular pacing and offering improved cardiac function and patient outcomes. Advanced sensing and algorithms. Future pacemakers will likely incorporate even more sophisticated sensors and artificial intelligence, AI, to further optimize pacing parameters in real time. These intelligent algorithms could adapt to subtle physiological changes, predict potential issues, like worsening heart failure, and automatically fine-tune settings for optimal patient benefit. Leadless pacemakers, expanded applications. While currently limited to single-chamber applications, ongoing research is exploring leadless technologies for dual-chamber or even biventricular pacing, offering the potential for less invasive implantation and reduced lead-related complications. Improved remote monitoring. The capabilities of remote monitoring systems will continue to expand, allowing for even more comprehensive data collection, earlier detection of device or patient-related concerns, and seamless adjustments to therapy without frequent in-person visits. These systems are becoming crucial tools for proactive management of CHF. Conclusion: navigating heart health with a pacemaker. Managing congestive heart failure with a pacemaker is a continuous, dynamic process that requires a truly holistic approach. It's about far more than just maintaining a steady beat. It involves a deep understanding of your specific pacemaker type and its intricate programming, careful consideration of how medications like metoprolol interact with your device, and thoughtful integration of appropriate exercise into your life. This journey demands vigilance and active participation from the patient. Understanding the signs of potential pacemaker malfunction and taking proactive steps to support device function, such as attending all follow-up appointments, utilizing remote monitoring, being mindful of electromagnetic interference, and protecting the implant site, are crucial for long-term safety and well-being. Ultimately, optimizing care is a collaborative effort. Open communication between you and your healthcare team, combined with personalized adjustments to both pacemaker settings and lifestyle recommendations, is essential. By finding the right rhythm that respects your individual needs and limitations, you can effectively manage your CHF. As technology continues to advance with emerging innovations like conduction system pacing and more intelligent devices, the future promises even more precise and personalized care. Staying informed and engaged with your medical team empowers you to be an active partner in your health journey.